Good morning. I'm Pat Living with the Department of Health and Social Services and your moderator for the COVID-19 update for Wednesday, August 4th. We are joined today by the Minister of Education, the Honourable Jeanie McLean, and Yukon's Chief Medical Officer of Health, Dr. Brendan Hanley. Our sign language interpretation is provided by Kevin Klein and our French language translation by André Boursier. Following our speakers, we will go to the phone lines for questions from reporters. We will call you by name and you will each have 2 questions. Minister McLean?
Thank you so much, Pat, and thank you for joining us on the traditional territory of the Kwanlin First Nation and the Ta'an-Quechan Council. It's really good to be here this morning with Dr. Hanley. Thank you so much for joining me today. This is my actual first news conference since the pandemic started in terms of the weekly update. So I'm really happy to be here with all of you today. As you know, effective today, we have lifted some of the restrictions that have been in place here in the territory based on the recommendations from Dr. Hanley. Mask use in indoor spaces is no longer mandatory, but it is strongly encouraged, particularly when people are in crowded or closed quarters and where it is difficult to physically distance. It is important to keep in mind that private establishments have the right to request that their clients wear masks before entering the space. This includes retail shops, grocers, bars and restaurants, recreational centers, public or private transit. We encourage everyone to respect these requests and other health and safety protocols that are in place. Self-isolation is no longer required for those entering the territory. Bars and restaurants can also return to full capacity for bar and countertop service. I understand Dr. Hanley will have more to say in a moment about group sizes at bars and restaurants. Despite these changes, the following measures remain in place. Contact tracing information sheets at bars and restaurants. Gathering sizes remain the same. Social gatherings are limited to 20 indoors, and physical distancing and limited to 100 outdoors with physical distancing. Organized gatherings, both indoor and out, are limited to 200 with physical distancing. Unvaccinated individuals should stick to 6 and keep their circles small. Mask use will continue at airports and in offices, at health and allied health professionals, including physicians, dentists, and massage therapists. Gathering limits remain in gyms, recreational centers, and fitness studios. Again, today's changes are based on recommendations from our Chief Medical Officer. With 8 out of 10 Yukoners fully vaccinated and case counts decreasing now, the restrictions are no longer justified, and we have a responsibility to lift them. Our daily case counts have been decreasing, and our vaccine uptake rates are increasing. This is what we need to see. And thank you so much, Yukoners, for doing your part. If these trends continue, we will be in a position to lift the state of emergency later this month. But regardless of whether that happens, we remain focused on protecting the health and safety of Yukoners. As the Premier discussed last week, we have a number of tools we continue to use in response to the pandemic and will continue to actively manage the situation. We are simply adjusting our approach. Testing, rapid response teams, critical social support workers, and expanded vaccine access are just some of the tools we are using as part of our new paradigm, we are in. We will continue to follow the recommendations of the Chief Medical Officer of Health as we have throughout the entire pandemic. If the risks change, we will adapt as necessary. The availability of vaccines has completely changed the landscape when it comes to COVID-19 and significantly changed the risks we are facing as Yukoners. We have one of the highest vaccination rates in the world. 7 months ago today, we delivered the first vaccines to some of the elders and staff at Whistle Bend Place. Today, more than 81% of adults are fully vaccinated, and nearly 65% of our youth aged 12 to 17 are fully vaccinated. That is a remarkable achievement, Yukoners, and I want to thank all of the folks that have worked on the vaccine rollout along with our community partners. The vaccines have saved lives, and every person in the territory that steps up to take their shot is helping to protect themselves and all Yukoners. The vaccines are still available, and we have enough for everyone that wants one. The mobile clinics are touring the communities again. They are in Pelly Crossing today, Carmacks tomorrow, and Dawson City on Friday. Next week, they will be in Tuslin, Ross River, and Old Crow. In Whitehorse, the clinic is open Tuesdays and Thursdays from 9 to 4:30 p.m. and on Wednesdays from noon to 7 p.m. You can book an appointment online at yukon.ca. Walk-ins are also welcome. Our vaccine rates are the highest in the country, which I've already mentioned, but I know we can get them even higher. The more people that get vaccinated, the safer we will all be. So please, if you haven't already taken the step to get your shot, please do so. This is what we can do. I know the day that I received my vaccine, I knew that I was doing my part to keep Yukoners safe, and I knew that it was my path to being able to gather again and to see, we got to visit our little grandbaby in June for the first time. And that's what it means to me personally. So I think it's a really important step and one that we can all take. I want to thank Yukoners, though, that have spoken out about how catching COVID-19 helped them overcome their vaccine hesitancy and who have urged others to take their shot. Some of these folks that have spoken out are really close personal friends of mine. And it's been a really difficult couple of months watching them struggle, and to see them now recovering is a miracle, I think, for some of these individuals. And I take it very personally. And living in a small territory with so few people, it is personal. And so I really encourage Yukoners to listen to some of those stories and take them to heart, because it's important. As I said, of course, vaccines save lives, and more people that get vaccinated, the safer this territory will be. And I think that it sends a message to the rest of Canada. Look at what we've done. Look what we've done as Yukoners. And thank you for allowing me those moments to talk about some personal things. But today I'm pleased to provide an update on our planning for the upcoming school year. This past year has been a challenging one, to say the least, and I want to thank all of our educators, support staff, administrators, families, and students for your resiliency, creativity, flexibility, and dedication to continue learning throughout the pandemic. Truly, thank you. We had a very good and successful year last year. Together, we learned a lot about the virus and how best to mitigate risk and alleviate any potential exposures and outbreaks in our schools. Thanks to your continued efforts and Yukoners' willingness to roll up their sleeves and get vaccinated, we are confident that we can safely return students to the classroom in the coming weeks. I'm pleased to share with you that schools will return to near normal operations, offering full-time in-class instruction, with some measures continuing to be in place to keep our schools as low-risk settings. From the outset of the pandemic, our response has been guided by the recommendations of Dr. Hanley, the Chief Medical Officer of Health, and this year is no different. With our back-to-school planning well underway, we continue to work closely with Dr. Hanley and his team to ensure our students can return to learning in a safe and healthy environment. We have been working on updated guidelines for schools, student transportation, and licensed childcare centres, which will be available in the coming days. I want to assure you that our response is being developed with a vision of working together and supporting each other to feel safe and comfortable in this new way of living and learning, and I will be personally involved in many meetings to come in the weeks to come with our partners to ensure that I am hearing the concerns of Yukoners and that we're planning together. Students will not be required to wear a mask in the classroom this year, but all students age 5 and older, including staff, should wear masks in all indoor settings outside of the classroom, such as common areas and hallways. As the Premier and Dr. Hanley both said, just because masks are no longer required doesn't mean you're not allowed to wear them. If wearing a mask makes you feel more safe, more protected, then by all means, please wear a mask. We need to continue looking after each other and ourselves with kindness, patience, and compassion. Personally, I will keep my mask handy in case I'm interacting with someone who prefers that I wear a mask, and I'll ask them if they'd feel more comfortable or safe if I'm wearing a mask. Again, operating from a place of kindness, patience, and compassion, I think, is where we should be, and treating each other in that way. Physical distancing will no longer be required, but it will be important to avoid crowding in common areas like hallways and at entrances and exits at the start and end of each day. Just like outside of schools, we encourage people to be mindful of each other's personal space. Hand and respiratory hygiene practices are still encouraged to help reduce potential spread. And as always, anyone who feels sick should stay home and get tested if they have symptoms. We are updating the traffic light assessment tool, and we'll be making it available before the start of the school year. I'm sure that many of you also have questions about what busing looks like this year, and I'm pleased to share that school busing will be at normal operation with the added measure of required mask use for drivers and riders age 5 and older. Bus routes for the new school year are now available to view at yukon.ca, and all registered riders should have received their seat assignment last week. If you think you are registered but did not receive your route information, please reach out to the student transportation officer. If you are new to the Yukon or missed out on registering for this bus year, and you need a seat, please, I encourage you to reach out to the student transportation officer today to reserve your spot by emailing student.transportation@yukon.ca. High school students are utilizing a City of Whitehorse Transit Pass and will be required to follow the guidelines established by the public transportation. As we transition into the new school year, I also want to remind all drivers to reduce their speed and be mindful of school zones coming back into effect. I know it seems like just yesterday school was out, but it's coming back fast. So please be aware of your speed in the school zones. I'm so excited that students can return to school with some normalcy this year. But as we prepare to return to the classroom, it is important to understand that we will continue to see cases in our territory. Continued learning for all students has been a priority since the beginning of the pandemic, and we will ensure there is flexibility over the course of the school year to ensure learning continues going forward. We have seen we have seen that clusters and outbreaks are mostly affecting people who are unable to or choose not to get the vaccine. So the best way to protect everyone is for us to get our vaccination rates to as close as 100% as possible. As I mentioned, more than 64% of Yukoners aged 12 to 17 are fully vaccinated, which is amazing. Last week, we announced expanded eligibility for vaccines, so anyone born in 2009 is eligible for the Pfizer vaccine, even if they have not yet turned 12 years old. This is a very important step before students start returning to school in 2 weeks, and I urge you to please take your shot today if you haven't already. The vaccine is helping to protect ourselves, our communities, and our vulnerable family members, friends, and neighbors who cannot receive the vaccine. This includes all of our students under the age of 12 who are returning to school, early learning, and childcare programs this month. Through the tremendous efforts of educators, support staff, and administrators, Yukon was one of the few jurisdictions to keep K-12 schools open and operating safely throughout the 2020-2021 school year. We have shown that we can keep our schools open and safe for students when we look after each other and keep one another safe. This allowed many students to benefit from the academic, social, and emotional supports that come with in-person learning and the school environment. We also recognize that COVID-19 has impacted students, staff, and families in many different ways, and we have not yet fully realized some of the longer-term impacts for sure. We checked in with students and staff and families at the end of the school year through our third learning during COVID survey to gauge how they were doing at the end of the 2020-2021 school year, with a particular focus on mental health, accessing supports, and potential lost learning. This feedback will help us identify longer-term impacts and assist us in putting the necessary supports in place. Together with the new guidelines from Dr. Hanley, the survey results will help inform operational plans for each individual school. While there is much to consider, and we continue our back-to-school, as we continue our back-to-school planning, I'm confident that the lessons we have learned over the past year, together with the guidance from Dr. Hanley and the team, will allow us to have a successful school year. So we will have more information to share in the coming weeks, and you'll be able to find your individual operational plans on yukon.ca, and those plans will also be sent to all parents and individual households. Thank you.
Thank you, Minister McLean. Dr. Hanley?
Masicho. Thank you, Minister McLean. Thanks for your very heartfelt words as well. And I think that really speaks from the heart. Good morning and bonjour, everyone. I want to talk about a few things today, of course, and we'll reflect on the schools later on. And this is another landmark day today as we continue our transition from pandemic to endemic COVID-19, and a significant next phase of our COVID-19 journey. And I acknowledge that while some people cannot wait for these further removals of restrictions, others are looking at COVID's rising activity in some of the provinces and wondering whether this is the right time. As always, we have to find the most balanced way forward, recognizing where restrictions can no longer be justified by the evidence, and refocusing our efforts on measures that are more effective and less onerous on the population. The fall and winter season ahead of us will be challenging to navigate as we anticipate the return of many viruses in addition to COVID-19. The pandemic has many twists and turns to throw at us yet, and we will likely see introductions of Delta and other variants. We may see further outbreaks, and we may even see fading immunity in our population. But with an ongoing strong public health response and with the new tools that we have at our disposal, we will be able to meet and overcome these hurdles as we always have. For status of cases, as of the end of yesterday, there were 61 active cases of COVID-19 in the territory. 481 people have recovered since this wave began in June. 6 Yukoners have died since the wave, and 8 overall since the start of this pandemic. As of yesterday, a total of 59 people have been hospitalized, of whom 50 were either unvaccinated or partially vaccinated. 14 people have been medevaced out of territory for further care, of whom 12 were unvaccinated. And most of these patients are still presently in hospital care down south. In our situation, 85% of our cases are those who were unvaccinated or partially vaccinated. And 78 of the cases, about 14%, are fully vaccinated. I know that all eyes are on the Delta variant at the moment as we watch cases rise dramatically in some U.S. states and as we also see concerning rises in Delta variant COVID cases in many of the provinces. How large an impact the variant will have in areas with higher vaccination rates is still uncertain. For example, to the surprise of many fearing a rising surge, cases in the UK have actually been dropping over the last few days, likely a reflection of high rates of adult vaccination, comparable to what we have here in Yukon. In fact, UK first dose adult uptake is 88% and 73% are fully vaccinated. Compare that to 86% first dose and 81%. So more than full 10 percentage points higher Yukon fully vaccinated compared to UK. Where we can be more certain is that Delta will thrive and already is thriving in areas with low vaccine coverage, such as Florida and many of the southern states. As explained last week, our projections for Yukon indicate that the risk over the next few weeks to months of Delta importations is low, based on Canada's high vaccine rate and low overall activity. Nevertheless, sooner or later, Delta will come into the territory. Perhaps it already has. What impact the variant will have depends on several things. First, what will the population uptake of vaccine be at the time? Second, will it appear in an area in Yukon with lower or higher vaccine uptake? Third, will it find a chance to take off in a situation where unvaccinated people are gathering? Fourth, will it hit, once again, a largely vulnerable population? To minimize the impact of Delta introductions, we must continue to keep gatherings safe by limiting numbers of unvaccinated people who gather closely with others, by smart use of masks, and by continuing to work hard to decrease our pool of susceptible people by increasing vaccination rates. So what does this exactly mean for Yukon? What we are seeing right now with Gamma, we could see again with Delta, and perhaps worse. Just as with the Gamma variant, Delta coronavirus will quickly infect as many people as possible and can easily do so in highly concentrated groupings of those who are unvaccinated. Just like Gamma, we will also see vaccinated people infected, but to a much lesser degree and with much better outcomes. We may also see vaccinated people transmit the virus to others, and recent studies suggest that may happen more than we thought. So prudence, even amongst fully vaccinated people, is definitely warranted until we learn more about how the Delta virus behaves and what kind of impact it will have in the provinces. As we watch other countries who are beginning to feel the effects of Delta, and there is talk, of course, of a fourth wave, we need to recognize that we still have substantial pockets of low vaccination rates within our population, leaving many susceptible. Until we reach at least 90% of our population our eligible population being fully vaccinated. And until that degree of uptake is uniform around the territory, we must be prepared to handle the risk of substantial further outbreaks. Even as we phase out of further restrictive measures, we must all do our part to limit the spread and impact of future COVID introductions. What does 90% of eligible population mean? Well, by the end of July, about 11,000 Yukoners overall of all ages had not received any vaccine. Our overall uptake per total population is 74% first dose, 69% fully vaccinated. So if we estimate the under 12 population as about 5,500, that leaves about 5,500 people over 12 who are unvaccinated and that could be vaccinated. If we could reduce that pool by half or more, we could substantially reduce the risk of Delta virus or other variants having a large impact. So we should aim to get 4,000 to 5,000 people more vaccinated, more people vaccinated to close in on 90% of our over 12 population. For the time being, we will be taking a cautious approach in coming months. All the more caution must be taken by those who are not yet eligible for vaccine or for those who remain unvaccinated by choice. By far, our best protection against any variant is 2 doses of vaccine, and we are so fortunate here to have so many opportunities to get vaccinated. Don't be fooled, though, given the many ongoing opportunities to get vaccinated, that there is no hurry to make a vaccine appointment. Please don't delay, because this virus will keep looking for susceptible hosts. As we move from pandemic mode to endemic mode, we are shifting the approach to that of managing a vaccine-preventable disease. Our goal is now shifting from one of overall containment to one that is focused on reducing the impacts of COVID by limiting its spread and avoiding as much severe illness and death as we can. So do the right thing, Yukoners, and get vaccinated. And please, some of you are late for your second shot. One shot is not enough, as we are seeing, to completely protect you. Please make your appointment now if you're overdue. Well, effective today, of course, mandatory masking and quarantine requirements after travel will no longer be enforced. We have walked through these liftings and the rationale a few times now. For the easements on the masking mandate and the quarantine requirements, these are based on the reality that these are no longer defensible measures for a highly vaccinated population such as ours. Does this mean we are taking on added risk? No matter what we do, we are always taking on risk. The risk of carrying on with broad restrictive measures as we wait for Delta to come would be high risk to our well-being and high risk to our ability to adapt to the ongoing reality of COVID. The risk of lifting quarantine measures for all is that we increase the chance of COVID coming in. That is true, but again, our projections for the time being are that the risk is small. On average, we would expect one introduction every few weeks, compared to the several every week that we would have had during previous and have had during previous waves of COVID in Canada. What about mask mandates? We are seeing them lifted around the country in most areas, but as the Minister McLean said, it does not mean that you should throw away the mask. Rather, keep it safely in your pocket or your purse and use it when required by an establishment or when you're entering an indoor space where there may be the 3 C's: closed spaces with poor ventilation, people in close contact, or crowded spaces. Let's get smarter about when and where we use masks and keep this habit at least through the coming months. Note again that mask usage will remain in place and continue at airports, as well as in offices of health and allied health professionals where physical distancing is not possible. Well, in fact, our recommendation since CMOH is that mask use will be required in those clinics and allied health professional in the allied health professional circumstances, such as Minister McLean referred to. So I'm talking about doctors' offices, dentists, optometrists, massage therapists, chiropractors, etc. As for bars and restaurants, I know that recent changes have met with mixed reaction. I get that some feel, until we get back to allowing more people to gather within the bars, the limited adjustments that we're recommending now may have limited effect on profit lines. On the other hand, these are further cautious steps towards what we would all like, the ability to gather freely in our favorite establishments. We have heard feedback directly from bar and restaurant owners, and we have moved up our recommendation to remove the 6 to a table restriction so that as of today, you may have unrestricted table size. However, the other restrictions for now do remain so that there is still no mingling allowed in the bars and restaurants, and as yet, no dancing allowed. Physical distancing and wearing a mask when requested before entering an establishment also remain in place. In fact, I urge Yukoners, before entering any business, whether you're just getting a beer at a bar or going into a retail shop on Main Street, ensure that you're well aware of the rules that these establishments have in place and follow them accordingly. And of course, any questions about current recommendations, make sure to go to yukon.ca, and a number of guidelines are being posted today. The Minister of Health and Social Services, Minister McPhee, reiterated this morning on CBC Radio the new tools we will use as we move out of emergency mode. And I thought these are worth repeating from what I was talking about last week. And I know that the Minister's intention is that all these pillars are in partnership with our communities and First Nations. And first of all, vaccination as an ongoing strategy, an active vaccination strategy to address hesitancy and to continue to reach our susceptible individuals with outreach and innovation and collaborative work with partners. Again, a goal of 90 to 95% of eligible populations at the moment, down to 12 years old, and then reaching out to younger children if and when they become available. And this, again, is our cornerstone of prevention. The other pillars, testing and surveillance, so developing a new testing strategy that's based on our current reality as well as the current technologies. Social supports for vulnerable people, both continuing the investment in preventative social supports, so we improve the resiliency of people to infection and improve the uptake of vaccine in this population, and then surge social support. So when people are infected or need to self-isolate, that they have augmented supports in place to facilitate that. And then overall surge capacity to our healthcare system and to our public health system so that we're readily able to meet increased demand in face of an outbreak or a surge. And then what I call focused public health measures. So as we move away from these broad overarching tools and mandates, just equipping people with tools to make the right choices. So examples are ongoing guidance for what to do when sick, including avoiding work and gathering places, tools and helps for assessing when to wear a mask, as I was referring to, using things like the 3 Cs for indoor spaces. And then advice on physical distancing, safe 6, reducing gathering sizes, and that might be flexible as we encounter waves and surges in the months ahead. So as elsewhere in Canada, I'm sure every parent wants to know what back to school will look like this year, and I thank Minister McLean for outlining clearly, as she said, that my office has, through this pandemic, closely collaborated with the Department of Education to ensure that school staff and students and parents are well prepared, and well prepared again for this upcoming year. And we do anticipate that schools can return to near normal operations while keeping the school as a predominantly low-risk setting for possible COVID-19 infection. And there will be further direction and guidance, as Minister McLean noted, posted. But for the time being, these following key pillars for Yukon schools are what we are recommending to support that low-risk environment. And again, vaccination, number one. And I know that not everyone can get vaccinated at this time for the students, but those who are eligible in the 12 to 17 age group, as well as staff, are strongly encouraged to get vaccinated. Staying home when sick, another huge preventative tool, and this will be essential to a safe school year. So before your children go to school, parents and guardians need to assess their children for any symptoms before leaving home. And the same advice goes for staff. And even if symptoms are mild, perhaps passed off for the flu, a cold, allergies, it is important that symptoms are taken seriously. And this means also booking a test when symptoms appear. We will be reevaluating our traffic light guidance to make sure that it remains pragmatic for the coming year. This, what was I going to say? We will be reevaluating that traffic guidance, but for the time being, what I would say is if your child has that simple runny nose, I do advise keeping your child home at least for a day, and stay tuned, because as we review and revise the traffic light guidance, further guidance will come before kids are back in school. The third is ventilation and cleaning practices, and schools will be advised and instructed to ensure that all ventilation systems are working properly, and our information is that they are at this point. We want to ensure good airflow and optimal ventilation within the school. We know how that ventilation is increasingly recognized as important in reducing the risk of spread for a virus that can, under certain circumstances, aerosolize. Physical distancing, so when in communal spaces, it'll be important that physical distancing remains integral, and that's in, again, looking at hallways and lunchrooms, areas like that, common spaces, to prevent possible crowding. However, we will be moving away from strict metrics of physical distancing. Hand hygiene and, of course, frequent hand hygiene, I believe, has helped to prevent seasonal illnesses and will continue to help to prevent illnesses as we adjust to living with COVID-19. So we need to really carry that on and instruct our children and staff to carry out proper hand hygiene, meaning washing your hands with soap and water for at least 20 seconds, or using classroom hand sanitizer if that's not available. And last and certainly not least, masking. So masking will remain an important tool within our schools, and it's recommended for all students aged 5 and older, as well as staff, to wear masks while in indoor settings outside of the classroom. And that's including, again, hallways, going from class to class, common areas, and on school buses. And similar to what we produced last year, there will be exceptions for, of course, kids participating in physical activities, eating and drinking, and other practical considerations. So yes, I know that there's uncertainty when it comes to sending kids back to school, just as there was this time last year. and we're all watching the Delta variant, and we know that children need to be in as normal an environment as possible to support successful learning, mental health, and social development. And now we have experience and we have vaccine, two powerful tools that we did not have this time last year. And we have been very successful with our schools throughout this pandemic, and I'm confident we'll continue to be successful. Of course, we'll continue to work closely with the Department of Education and ensure that the schools remain a safe place for staff and children. So that's it for today. Let's stay together, stay patient, be kind. And thank you. Masicho Shonitan. Merci.
I'd like to thank you both, and we'll now go to the phone lines. We'll begin with Haley, Yukon News.
Thank you very much. I have a question for Minister McLean. We've heard this week, the way I understand it is a number of parents at Hidden Valley Elementary School are upset right now because they weren't informed by the school when a sex offender was convicted who was working at the school. I'm wondering if you could respond to that, if the school should have notified parents that this took place.
Thanks, Haley, for the question. This is a matter that is before the courts right now, and we're determining further investigation. So I will not be making any public comments about that at this time. Thank you.
Thank you, Minister McLean. Haley, do you have a second question?
I do, yes. I realize there is a lawsuit before the courts, but I just have to ask again, why wasn't there a way that parents could have been notified despite the lawsuit? It just seems like some important information to know in order to talk to children and see if there could have been any more victims or other students affected.
Same answer as previous, Haley. Sorry, I'm not able to discuss this in a public forum at this point. Thank you.
Thank you. We'll move on to John from CKRW with a reminder that this is a COVID-19 update. Thank you. John?
Hi. Now, in the list of businesses that came out in yesterday evening's media release regarding who can issue their own recommendations for masking, there was nothing when it comes to personal services. There was retail shops and grocers, bars and restaurants, recreation centers, but barber shops and spas and such were still left out of the memo. I'm just wondering, maybe are they included and just weren't included in the information? What's the guidance for them?
Yes, thank you for bringing it up. Yeah, the expectations are the same, really, for personal care services as for other premises. And so, again, we strongly recommend mask use and really the continuation of mask use within these facilities. This is another area, and I would line it right up with what I talked about, those allied health professional settings where physical distancing is not possible. So similar to optometrists and optometrists, physiotherapists, where you need to be in that close range. So I do strongly recommend, and if we omitted to include them, then that's an oversight. So we'll make sure that's added. It is also, of course, they are also regulated facilities, even though masking does not fit in under the Public Health and Safety Act as regulations. They are otherwise facilities that come under all of those other regulations to make sure that principles of hygiene and sanitation are followed.
Thank you. John, do you have a second question?
No, thank you.
Thank you. We'll move now to Chuck, Whitehorse Star. Chuck, are you with us? We'll move on and come back to Chuck. We'll move to Brenna, Canadian Press.
Yeah.
Sorry,
Hello?
Chuck. Chuck, we've
Hello?
moved. Hello, Chuck. We've moved on. We'll come back to you.
Okay.
Thank you. Brenna, Canadian Press.
Hi, sure. I just
it's more of a clarifying question around bars and restaurants. Opening at full capacity, mingling is not allowed, but I'm just looking at information on the Yukon website. It says no physical distancing at bar counters. So it's just like kind of between tables, or can you kind of clarify what's going on at bars and restaurants?
Yeah, thank you for that. There was a previous recommendation that there must be 2 meters of spacing at bar counters, and we realized that was both onerous for the establishments in order to seat clients at the counter, customers at the counter, but also no longer necessary in our view. So we removed that separation specifically at bar counters, so that normal seating, reasonable seating to allow people the room to eat and have some to eat in normal circumstances. So that physical distancing really applies to seating at the counter. It does not apply to physical distancing, to letting go of physical distancing within the general premise.
Thank you. Next question, Brenna?
Sure. I guess I've heard you mention, Dr. Hanley, about the projections the territory has around Delta and vaccination rates and all of the other factors, but I guess I wonder about waiting until active cases declined even further, or what are some of the other indicators in the projections that show measures are able to be lifted now?
Yeah, well, of course, it's always looking at a variety of measures, and the COVID case activity right now is one of those measures, and we continue to really be in what I would call a long tail of COVID activity. We're certainly past spike activity. We're now seeing about a half dozen new cases a day, most of which are clearly linked to other cases, or what we call epi-linked, or have links to known cases and clusters. So we're not seeing widespread, random, community spread type transmission. So I feel confident that we are in a better place than we were a few weeks ago. We are likely over the coming weeks to see this kind of continued pattern, probably a very slow tapering. So that in itself is a pretty, I think, strong indicator. And of course, we then that enables our public health capacity and our healthcare capacity to recharge a little bit as we go forward, which is another indicator. The importation risk, as I described, based on our modeling of incoming travelers and vaccine status and overall COVID activity in Canada, is another one of our indicators. Yes, and our ability to have a public that really works along with us. So even as we move out of mandates into more of a guidance approach, we know, and we have seen so far, really, people by and large just want to do the right thing, but have that chance to have more individual control. So I do think we're in a strong place to be moving this way. I also think it's actually a good thing to be moving cautiously through these relaxing of restrictions while we have COVID activity, because I think it really, sometimes we get into this real all or none mode. If I look over the last year and a half, where we either have activity or we don't, and the population might react accordingly. And I think this is more probably a reality of the future, is that we will have COVID activity in the community. We need to adjust. So having actual cases reported day to day, I think allows us to maybe find that right place of using our own risk assessment and being cautious as we go through these removals of more of that territorial level mandates.
Thank you. Chuck, Whitehorse Star. Chuck?
Sorry, I'm here. There was a delay. Sorry, can you hear me now?
Go ahead, please, Chuck.
Okay, here I am. Dr. Hanley, I just want to get a clarification, first of all. So, masking in optometrist office, the dentist office, that will not be mandatory, but strongly recommended, or will it be mandatory?
It will not be mandatory. Of course, we have healthcare providers who do follow and always do follow the advice that we provide, whether that's to physicians, to community nurses, and to our allied health professionals. So we provide the advice for how to set up their business establishments and provide guidance, which is also publicly available, that guidance on personal protective equipment and infection control within those premises. So there is an expectation and a high compliance rate with what we provide, and that guides how, as practitioners, they use masks and other infection control measures, as well as their staff, and as well as how they see patients and what patients are expected to wear, or visitors when they come into the facility. So although it's not mandatory from a Yukon government approach, there is this strong guidance on how to set up a facility, and there is an expectation that clients wear a mask. Then the establishment can then determine if, in the case of non-compliance, whether that client will be served or not.
Thank you. Do you have a second question, Chuck?
Yeah, actually, that was a clarification. I have a couple questions here, if you want to. This is another clarification. I don't want to mess this up. So, in the return to school, students will not be required to wear masks in the classroom, but they will be required to wear masks and maintain physical distancing in the public spaces, such as the foyer and the hallways on the buses. Is that correct?
Yeah, and that will be provided as written guidance. So you don't have to get it all down right now, but that is the gist of it, and it will be reflected in written guidance on the website.
Yes, no?
I'm fine.
Okay. All right, Chuck, we're going to give you one more since you had two clarifications, but one more is it.
Okay. This is just an odd one. I was just listening to some news this morning, and they were saying that they were starting third round of vaccinations, and I think it was Spain, but it was a European country, and it was described as a booster. Are we looking at booster shots here sometime in the future?
Yeah, thanks. That you probably heard there was first Israel, and now Germany is, and there is another European country. It's not Spain, but anyway, you're right. So there is a future to booster shots. We just don't know what that future is yet. You may have heard the World Health Organization today really put out an urgent request that booster shots not be contemplated before September, to allow at least some of the rest of the world to catch up with the opportunity to have their first doses. So there are many many considerations. At some point there will be waning immunity that would require at least some people to have booster shots, potentially all of us, potentially at different times depending on age or immune status, or even the interval between the doses. So Canada, as yet, has not arrived at recommendations for booster shots. I do think that will be an eventuality, but we just don't know the timing yet. Right now, our focus is on first shots and second doses for those who are overdue for second doses.
Thank you. We'll move to Julian, CBC.
Yes, hi. Sorry about that. So I just have a couple of questions here, of course, and they sort of revolve around the updates in the schools. So I'm wondering, you know, it was sort of alluded to the fact that there could be some anticipated outbreaks in the territory, whether that's Delta or other variants, et cetera. So I just wanted to ask what the plan is to stem a possible outbreak in schools if one should arise.
Do you want to start? Or you?
I can start, and Dr. Hanley can join in for sure. We'll continue to work with the Chief Medical Officer, as we have all along, to assess the risk to schools and to larger populations, and we will ensure that our number one priority is always the safety of our children and Yukoners overall, and so we'll continue to work with our school administrators, our school councils as well, to ensure that the right plans are in place. And yes, it's inevitable that cases will come, potentially into our school. Last year, we had a really great year, and I think that following the close advice of the Chief Medical Officer, we can have another successful year like that. That's what I'm hoping for as the new Minister of Education, and but I can maybe turn it over to Dr. Hanley to speak more specifically about what that would look like if we were to see an outbreak or a larger outbreak in a school. Thank you.
Yeah, thanks. Of course, we've had plans in place since the beginning of the pandemic for what happens if there's a case in a child who attends school, within the classroom. What happens if there's transmission within either the school or the classroom? And what happens even if there's an outbreak? So there are these different levels, and the most common level, what you usually see with a school is that cases in schools reflect what's going on in the community. So, and that's a bit of what we saw just at the end of the school year last year, when we had the onset of our wave, and then we had some cases associated with children. There was we had no evidence of any transmission within a classroom and within an organized school setting. What we did see was possible transmission between kids, more in some of the unorganized social activities just at the end of school. So we did well. We do have those protocols, and the protocols involve, immediate isolation of a student with symptoms, arranging for testing, notification of the families. Of course, that children being pulled from school during the infectious period, and then that usual, the close work that YCDC, Yukon Communicable Disease Control, they really take charge of this in terms of identifying any possible contacts. Sometimes there may be no contacts within the school. Let's say a child was identified, but not identified to be infectious during their time in school, or if they were infectious, then determining who is at risk of exposure. Is it confined to the classroom? Is there a potential wider exposure? So all of that evaluation takes place, and we have very specific guidance for how that occurs. Then there would be, if there is transmission within a school, declaration of an outbreak, and that outbreak could be limited to a small area, it could be limited to a classroom, it could be wider in the school. Our efforts certainly would be, with that, with the ability to do this and to be able to quickly respond. I would anticipate we will be able to keep the schools going. That has always been our intention, even in the pre-vaccination era.
Thank you. Julian, do you have a second question?
I do. I'm just wondering whether vaccination for staff and students will become mandatory? And then also, too, why masks aren't mandatory for kids in class? If you can elaborate on that point.
I'll start. Yukon government currently does not have any mandatory COVID-19 vaccine policy in place for staff, including our healthcare staff. It is clear that though that vaccination provides a strong barrier against COVID-19, as an employer, the health and well-being of our employees is a top priority, and of course for our children in the schools. So we are strongly encouraging folks to get vaccinated, but at this point we do not have a mandatory vaccine policy.
Okay. Dr. Hanley?
I would just say that I completely agree with the minister. I think, the most that we can achieve with the least coercion is always the way we should go. At the same time, I have asked my team and the department to look at, the range of policy options that, and then what it would take. And so we know that this is occurring in some of the provinces. And there may be opportunities to look at what are the other immunizations that are important for children to have as they enter school. And there are some provinces that have had policies in place, Manitoba, New Brunswick, Ontario, for a long time. And again, a range of policies from kind of a mandatory with exemption, with an exemption process, to simply a declaration of status of immunization, so that then there's a chance to have a conversation about vaccine and to try to make sure that questions are answered and there's every opportunity to have vaccine. So I do think that there are possible options. I don't think this is something to rush into. There are many different considerations, but I think it's important to set up an expectation, that we do everything possible to prevent the chance of a vaccine-preventable disease being transmitted within a school setting, and that includes COVID-19.
Thank you. On va maintenant passer à Vincent, Radio-Canada.
Oui, bonjour. Docteur Hanley, est-ce que je peux vous demander tout d'abord de résumer en français les recommandations que vous avez faites pour la prochaine rentrée des classes et pourquoi vous êtes confiant dans le fait que une rentrée presque normale soit possible?
So, Dr. Hanley, could you please repeat in French what are the recommendations you have for the beginning of the school year, and what you're expecting to see in the coming school year as a normal way of going to school for the students?
Merci Vincent. Oui, c'est important que les enfants ont une chance d'avoir un environnement le plus normal possible pour avoir l'environnement pour bien apprendre et pour socialiser et pour le bien-être et le développement de la santé mentale et l'apprentissage en général. Donc, avec ça, vaccination de ceux qui sont éligibles pour la vaccination, le 12+, et aussi avec les personnels, de continuer d'encourager la vaccination pour toutes qui sont dont c'est possible de recevoir les vaccins. Et deuxièmement, comme on a parlé beaucoup de temps, pour le dépistage des enfants tous les jours, pour assurer que les enfants qui sont malades entrent par l'école, donc qu'elles restent à la maison, et puis pour subir à la dépistage pour voir si c'est COVID ou si c'est quelque chose d'autre. et voir avec la ventilation, pour optimiser la ventilation dans l'école, pour une approche pratique pour la distance physique, pour maintenir une distance physique entre les gens. Et surtout dans les endroits où on a plus de gens. Et puis la sanitation, bien sûr, des mains, et aussi de porter des masques. Dans les endroits communs. Donc, et c'est pour l'âge 5 et plus. Et avec les personnels aussi, de porter les masques à l'intérieur, mais pas dans les salles même. Donc pour avoir aussi cette balance où on a, si la classe est bien organisée, comme ils ont fait jusqu'au maintenant, on ne voit pas un environnement pour transmission d'infection dans la classe. Mais dans les areas où on a beaucoup plus de mélange de gens, là, on demande pour avoir le portage de masques.
Thank you. I won't ask you to repeat that in English because both you and Minister McLean spoke to that in great detail. Avez-vous une autre question, Vincent?
Oui, merci. Juste pour résumer, en gros, à l'école, comme dans le reste de la société, maintenant, ça repose sur ça repose sur la responsabilité individuelle. Pouvez-vous expliquer aussi pourquoi il n'y aura pas de vaccination, et s'il n'y aura pas, mais je l'ai compris en anglais, s'il n'y a pas de vaccination pour les élèves et les enseignants ou le personnel en milieu scolaire?
So, can you please explain why there will be no obligatory vaccination, and why we are relying on personal compliance to the measures that you have suggested at this point?
Oui, pour le moment, on travaille avec les outils qu'on a en place et pour demander la coopération des personnels qui est, je peux dire que c'est assez forte, même que j'ai pas les chiffres. Je sais qu'il y a beaucoup de coopération selon les personnels avec de recevoir la vaccination, et aussi on voit un montage de taux de vaccination chez les enfants de 12 ans plus. Donc, si on peut réussir sans une obligation, c'est toujours mieux de faire le mieux sans les outils trop lourds pour la situation. Mais en même temps, comme j'ai expliqué en anglais, j'ai demandé un review du département de qu'est-ce qu'il y a sur le menu des options pour avoir les mesures obligatoires. Et ça, même dans cette il y a une variété de mesures qu'on peut avoir qui peut-être sont pas nécessairement un mandat, mais peut être une obligation de expliquer le status, si on est vacciné ou non, et pour avoir donc une opportunité de parler de vaccin, pour avoir une session éducative, par exemple, pour promouvoir le vaccin. Donc, avec le principal de toujours chercher les moyens les plus légers pour arriver au but, il y a des politiques sous exploration, mais on va voir avec le temps qu'est-ce qu'on peut arriver avec l'encouragement des gens. Et c'est aussi, this is also what I've explained in English.
Yes, I was just going to say that. Thank you. Merci, Vincent. We'll move now to Jackie, CBC.
Hi, my questions are for the minister. Like Haley mentioned, I've heard from a number of concerned parents with children at Hidden Valley. I know several have written directly to you, as has the Yukon Party MLA Brad Cathers.
Jackie, I'm sorry, I'm going to shut that down. Minister McLean has already spoken to that question. Do you have a question related to the COVID briefing this morning?
Minister, what do you say to concerned parents, and will you respond to...
Thank you very much. I'd like to thank everyone for their attendance today. The next COVID-19 update will take place on Wednesday, August 11th at 10:30 a.m.